All right, folks, we're less than a month away from the midterm elections, but key races are heating up. What issues are bringing voters to the polls? For more on this, let's welcome in Michigan gubernatorial candidate Tudor Dixon. Tudor, appreciate you being here.
Thank you for having me.
All right, so Michigan, highly contested state. Gretchen Whitmer really didn't do that great a job at all during the shutdowns and glaring hypocrisy and a variety of other things. But we're closing in on an election for you in a month. How are things looking and what are the big issues out there?
We think things are looking really good. We have the latest polling from Trafalgar has us less than 6 points apart. Right now, people on the ground are saying we have outrageous costs. Inflation is so high, but in Michigan, we have higher gas prices than almost any other state. We've got a crisis going on with 2 refineries down in the Midwest. The governor has not commented on this. She has not offered any relief to Michigan people. We're hearing about that. We're hearing about education because, as you said, her lockdowns were cruel and they were different than any other state. She kept our kids out of school for almost 2 years. So our students are incredibly behind. We also have the rise in crime that other states are seeing. We're seeing it on a different level.
You mentioned those polls, though. If you go back a month, you weren't even within double digits of her, so you're climbing rapidly, no?
Yes, and this is after she spent, and the Democrat Party has spent $23 million. So, you know, it's funny how things work sometimes. People said, how can you get the name ID that Gretchen Whitmer has? I said, you know what? She's spending the money for me. So now we go into gas stations, we go into the grocery store, people stop me and say, I'm voting for you. We need a change.
Tudor, what are you hearing from voters about what they actually care about?
Definitely education. As I said, our kids are really behind. So we just got our test scores back from the spring, and our third graders failed at a nearly 60% rate across the state, failed reading and writing. We need to get our kids back on track. We've come out with a 25-hour tutoring plan for each child using that money that we got in for COVID that was earmarked for education. The governor, after we presented that, said she also has a tutoring plan. Well, you know what, folks? It's October. We've seen nothing. Our kids are still struggling. Our class sizes are large without assistance in there. Yeah. And we need to get into those schools and get the kids back on track.
She ain't got a plan. She would have put it forward already. But a lot of people don't know this. You built a career in the steel industry throughout the early 2000s. I mean, I would talk about the price of steel, how critical that is, and how economically powerful that is if you unshackle the regulations and let Michiganders do their thing.
Well, that's the biggest problem in the state of Michigan. We have too many regulations and we have businesses leaving. So we've proposed reducing regulations by 40% in the first 4 years of our administration. But as you talk about steel prices, let's look at all prices, because if you're a manufacturer or if you're in the agriculture industry, including fertilizer, everything has gone up. It continues to go up as gas prices rise. And that's why it's so critical that this governor come out, but she's not going to, and say we're going to do something like a gas tax holiday while these refineries are getting back online. Because as we move product, the prices are soaring in the state of Michigan above other states right now.
Tudor, it's clear you have passion about your state, but not only that, you have a very impressive background. And October is also Breast Cancer Awareness Month. You're a mom of 4, and we know that you've battled this and you won. What can you tell us about this journey and inspiration for other people who may be experiencing it?
Yes, I was 38 when I was diagnosed. So when you get that diagnosis, you immediately think, gosh, you know, my kids won't remember me. What will it be? And we battled through it. I had great doctors. And I think that's something that we need to look at very closely right now, because as we've come out of COVID, we've really seen a lot of our hospital systems struggle. In the state of Michigan, significantly. We've had a couple of our hospital systems lay off hundreds of people. So we have to come back to a place where we're bringing in nurses and doctors, we're supporting our healthcare system, and making sure that anyone who is going through this terrible disease or any other health crisis, make sure that they don't feel like they don't have the support they need, the medical support that they need, because the United States has always been known for great healthcare. We've got to be able to bring back our doctors and nurses and support them in the way we need to.
Tudor, to hear you speak about great healthcare, we spoke to a nurse earlier who lost her job because of new training that implemented. You're mentioning layoffs in your state when it comes to the hospital system. Yeah. It is very important. So what do Americans do? What do voters do in Michigan if they don't have that?
Well, I'll tell you, you brought up a training. I want to address that because in the state of Michigan, the governor of Michigan implemented implicit bias training during COVID because she claimed that we had people dying because we had nurses and doctors who were looking at them from a biased perspective. Now, our nurses and doctors are disgusted by this. They say, I don't look at a patient any differently than the next. So now we've had people leave because every 2 years they have to take this implicit bias training. We have to respect our doctors and nurses, not say, hey, you're inherently racist and we know it's going to be a problem for every 2 years. You're going to have to be told this.
Right.
We have to immediately remove that. That's something she didn't do through the legislature, like everything that she's done. And this is something that is driving people away from the medical profession.
Yeah. Tudor Dixon, amazing story. We appreciate you being here.
Thank you. Thank you. Check out our website, TudorDixon.com.
Do.
No crooked establishment.
None of that twisting the truth. No talking down to me.
Don't tell me how to think.
Don't tell me how to think.
Don't tell me how to think.
I trust Newsmax.
Newsmax.
They don't tell me how to think.
They let
me decide.
Newsmax.
real news
For real people.